At the crossroads of history, Afghanistan is one of the most beautiful and compelling places on Earth. It's also one of the most challenging places in the world to be a child, and one of the most difficult environments anywhere for UNICEF and its partners to provide humanitarian assistance to children in need. UNICEF has been active in Afghanistan since 1950 and has been on the ground continually helping children despite adverse conditions, including 3 decades of conflict. Since 2001, there has been tremendous progress in Afghanistan. Millions of children in school, increased access to clean water and sanitation, the empowerment of women, and reductions in infant mortality. But today, it's increasingly difficult to build on these successes, the result of insecurity. Ongoing armed conflict, school burnings, suicide attacks, and the kidnapping and killing of humanitarian workers make it extraordinarily difficult to reach Afghans in need. UNICEF remains undeterred. We will continue to work with our many partners to break the spiral of violence, poverty, cultural barriers, and hopelessness, to build a society where children survive infancy and thrive into adulthood to become productive citizens, to create a better Afghanistan for all our people. A child's first right is the right to life, yet Afghanistan has some of the highest rates of infant and maternal mortality in the world. A key objective of UNICEF's Health and Nutrition Program is to reduce infant and maternal mortality by supporting and strengthening national health systems. To promote child survival, we promote programs to expand antenatal care for pregnant women, to increase access to skilled assistance at delivery and encourage breastfeeding, and provide training for hospital staff in the latest obstetric thinking. We support therapeutic feeding centers for malnourished newborns and incubators for the premature. We work with the Ministry of Health and dozens of partners to run expanded programs on immunization to control vaccine-preventable diseases such as polio and measles. And later in life, we support deworming initiatives in schools to promote healthy growth and learning. Despite millions of children being enrolled in school after the fall of the Taliban, 60% of Afghanistan's primary-age school children are not in school, especially girls. UNICEF's Basic Education and Gender Equality Program aims to increase enrollment in primary schools, ensuring a basic, quality education. Increasing literacy rates among adults is another focus. As always, gender inclusivity is paramount to everything UNICEF does. Thousands of schools do not have a building to teach in. Other schools have been attacked or destroyed. UNICEF provides temporary learning spaces, supports the building of cost-effective schools, and the establishment of community-based schools. We provide teaching materials and school supplies to thousands of young learners. UNICEF also supports the Healthy School Initiative, which exposes children to basic first aid principles and important lessons about sanitation and hygiene practices. Less than a quarter of all Afghans have access to clean water. Just over 10% access to adequate sanitation. Improving these numbers and raising overall hygiene awareness is the focus of the Water and Environmental Sanitation Program. UNICEF works with the government and other partners to develop community-based strategies. Schools and health centers are key entry points. Providing water points and gender-specific latrines results in better health for all and increased girls' enrollment in primary schools. The Healthy School Initiative is also at play here. Thousands of children have learned important lessons about hygiene, which they can take home to their families to help protect them from disease. Afghanistan's children face a variety of natural and man-made disasters across the country. UNICEF's Child Protection Program develops and implements policies to safeguard women and children from violence, exploitation and abuse, to those in detention for challenging social mores, those living on the street or forced to work. In schools or settlements affected by mines or fighting, safe play areas provide opportunity for carefree recreation and social interaction, while youth information and contact centers distribute crucial information to young people and provide a forum for them to participate in shaping the future of their country. UNICEF doesn't exist in a vacuum. Everything we do is in collaboration with partners. We work in coordination with the government, other UN agencies, the private sector, NGOs, a variety of donors, national committees, and thousands of individuals to help Afghanistan build a healthy, safer, more prosperous country. After 30 years of instability in Afghanistan, progress has been formidable. Yet this progress is threatened by insurgency and security. The challenges are great, but the potential of Afghanistan and the determination of its people to create a better world for their children is even greater. Every one of us has a role to play. The time for action is now. Unite for children.